Hello and welcome, dear researchers. Do you know what is a combination of chemotherapies? Let's start with the main question, which is why do we need a combination of therapies instead of increasing the dose of one certain therapy? As we can see from this graph, with the increase of dosage, the toxicity also increases till it reaches a certain limit known as maximum tolerated dose. Therefore, the efficacy of the treatment will be limited to this therapeutic window. However, if we added another type of chemotherapy, considering that they don't have an overlapping toxicities, can lead to effects that are more than the combination of their individual contributions, therefore requiring less doses of both therapies, and subsequently leading to less toxicity and more efficacy. Let's see a potential mechanism that explains this synergistic effect. When the cancer cells are dividing, a single type of chemotherapy or a certain class of chemotherapy like anti-cancer antibiotics can lead to the death of one cell and the survival of the other because it is resistant to the certain apoptotic mechanism induced by this therapy. However, when different classes of chemotherapies are combined, this can lead to the death of both cells because they are targeting different mechanisms inside the cells, so they complement the action of each others. So the main guidelines of the combination chemotherapies is first the classes. In the clinic, when you study the worldwide guidelines, you will find that most of them consist of different classes of chemotherapies. The second guiding point for the combinations is the toxicity, at which they tend to select the therapies that have non-overlapping side effects. Let's move to the first trial, where the clinicians and researchers tested the idea of combining different types of chemotherapies. In the acute lymphatic leukemia, which is a hematological malignancy, which means it arises in the blood cells, specifically the lymphoid lineage, whether it is a B cell or a T cell. The first drug in the combination is the 6-mercaptopurine, one type of the antimetabolites, specifically one of the false analogues. This drug showed complete remission of the disease in 27% of the patients, while the methotrexate, another type of antimetabolites that inhibits another step of the DNA synthesis, showed 21% of complete remission rate. The combination of both therapies targeting different steps of DNA synthesis and damaging the DNA in different ways showed 45% of response. And this was a spark for trying different combinations of therapies, like trying vincristine, which is a microtubules inhibitor. It acts by breaking down the microtubules formed, showed 47% of response, which triggered the clinicians to test it with prednisone, a corticosteroid drug that showed 57% of response alone. The combination of both therapies showed 84% of complete remission rate in acute lymphatic leukemia patients. Let's move to another example, which is the anaplastic astrocytoma, a type of brain tumors with which a protocol of treatment named PCV regimen stands for procarbazine and lomustine, two types of alkylating agents, together with vincristine, a microtubule inhibitor. This combination can be used under certain conditions that you can refer to in the FDA announcements. So for the side effects or toxicity, the alkylating agents showed low white blood cell counts and low platelets, which means it affects the neurons in the peripheral nervous system. So for the resistance against this combination or other type of alkylating agents in the brain tumors is the MGMT enzyme that has a cysteine residue. As we can see, chemically, the cysteine residue is consisting of a nucleophilic sulfur that can interact with the nearby alkyl, or here the methyl, and remove it from the guanine nucleotide, allowing the DNA to return to its original function and shape. Let's move to another type of combination chemotherapy, which is a combination with targeted therapies such as the bevacizumab, which is a VEGF inhibitor, specifically VEGF-A inhibitor, a growth factor that is secreted by platelets in order to induce the proliferation of endothelial cells, whether for wound healing or for angiogenesis, the formation of new blood vessels. This inhibitor is efficient because it stops the formation of new blood vessels that can supply the tumors. Let's see what are the combinations that can be made with bevacizumab. First, it can be administered alone in certain conditions of glioblastoma. Secondly, it can be combined with interferon alpha, an inflammatory cytokine, under certain conditions in renal cell carcinoma. Lastly, it can be combined with paclitaxel, a microtubule inhibitor that works by stabilizing the microtubule, that can be combined with an alkylating agent such as cisplatin or a topo inhibitor such as topotecan under certain conditions for metastatic cervical cancer. Another examples of combination chemotherapies can be seen in the colorectal cancer. One of them is the FOLFOX chemotherapy that targets the tumors of the colorectal cancer. It consists of folinic acid named as leucovorin, fluorouracil, an anti-metabolite that acts as a false analogs and can be inserted in the DNA, and lastly OX4-oxaliplatin, a type of alkylating agents. And now you are probably asking and wondering about the function of leucovorin. In this combination, leucovorin acts by compensating the deficiency of nucleic acid synthesis in the normal cell, while the cancer cells were shown that they cannot benefit from this therapy, making a differential or selective therapy towards the cancer cells. Let's move to the FOLFIRI combination, which stands for the same treatments except the IRI at the end stands for irinotecan, which is a topo-1 inhibitor. Let's move to another example of combination chemotherapies such as the carboplatin with paclitaxel in the small cell lung carcinoma, which is consisting of neuroendocrine cells. The carboplatin is an alkylating agent that can bind with one or two nucleotides, making cross-linking the two strands, while the paclitaxel, a microtubule stabilizer, showed a synergistic effect with carboplatin on the mechanism level by the increased formation of adducts observed. They found that carboplatin can form more adducts or more binding with the DNA upon the addition of paclitaxel. When removed, cancer cells were able to repair the damage that happened to them. As you can see, an abstract visualization of this process that the paclitaxel affects somehow the DNA repair mechanisms that can allow the removal of the carboplatin. Another type of combination consisted of an alkylating agent such as cisplatin with a topo inhibitor such as etiposide. Let's end the video with a possible FDA approved combination, which is from the class of antimetabolites, specifically a false analog. It can be combined with an alkylating agent such as cisplatin in the non-small cell lung cancer, which is originated from an epithelial cell. It can be combined with a microtubule stabilizer such as paclitaxel in the metastatic breast cancer. It can also be combined with another alkylating agent, carboplatin, in the advanced ovarian cancer, and it can be combined with the modified version of the paclitaxel, which means it's combined with albumin from the blood to be less toxic, and it can target the metastatic adenocarcinoma of pancreas for sure. All these combinations can be used only under certain conditions that is defined and updated yearly by the FDA. We didn't finish yet. I will give you an example of how this combination, the gemcitabine with the cisplatin, was discovered and applied on the patients. It all started with the cell line levels. They tested the gemcitabine with the cisplatin and they showed a synergistic effect on the cell line level, and afterwards when they tested them in the clinical trial, they found that 20% of patients showed remission, while the gemcitabine with the cisplatin showed remission rates that can start from 26 and reach 65% of remission, which means it can reach 3 times the effect of gemcitabine alone. So the lesson from these slides is that the proof of concept on the cell line is important for the guidance of the process of selecting a certain combination for a certain type of cancer cells. Let's end with a final example of combination chemotherapy that is used against a type of tumor named lymphoma that arise in the lymph nodes, that consists of cyclophosphamide and doxorubicin, a very famous anti-cancer antibiotic, and oncovine, a microtubule inhibitor, and prednisone, a corticosteroid drug. This combination showed efficacy under certain conditions of lymphoma. And by this we ended our mini lecture, and see you in the next one. If you are interested in the targeted therapy and you want to know more about the signaling pathways in the cell, please check the description for a premium course that is specifically tailored for you. Lastly, do you know what are the hormone therapies and how can they target the endocrinological tumors?